TRT seems to be all the rage with guys over 40. From everyone from Joe Rogan to The Rock to the Liver King, everyone seems to think that the best path forward once you hit 40 is to start supplementing truckloads of testosterone. So let's break this down. How do you know if you should start TRT, whether it's going to be beneficial for you, and what the best pathway to go down is? The first thing you need to understand is what TRT is and what TRT isn't. What TRT is the supplement of exogenous testosterone, that's testosterone from outside your body, to make up for a lack of endogenous testosterone, that's testosterone from inside your body. TRT is prescribed because your body isn't providing enough testosterone. However, it comes with a negative because as soon as you start adding testosterone into your system, your own production of testosterone, whether it's in the normal range or low, will become even lower because your body senses that it doesn't need to produce it anymore, and the body's incredibly lazy. It won't do things if it doesn't have to. It will lower its own production even more, meaning that once you go on testosterone replacement, you need to stay on it for good, because if you come off, your symptoms are actually going to be worse after being on and coming off than they were in the first place. Now, there are only two causes of low testosterone, and they're called primary and secondary hypogonadism. Primary hypogonadism simply means your body doesn't produce enough testosterone. The sign of this, when you look at your blood work, is a high level of luteinizing hormone, which is the hormone that stimulates testosterone production while having a corresponding low amount of testosterone. And what it's showing is that the body is working hard trying to get testosterone produced, but none is actually being produced. So high luteinizing hormone, low testosterone numbers are a sign of primary hypogonadism. And there are very few actual causes of this. One is getting older, and the other one is either testicular cancer or an injury to the testicles, like being repeatedly smashed in the balls. Secondary hypogonadism is very different. The sign of secondary hypogonadism is actually a suppression of luteinizing hormone. So you'll know straight away whether you've got primary or secondary hypogonadism simply by looking at the levels of luteinizing hormone and comparing them to the normal range within your blood work. Low levels will mean you've got secondary hypogonadism, and what that means is the body is unable to produce testosterone because something has suppressed that. The causes of secondary hypogonadism are a much longer list than the causes of primary hypogonadism. Secondary is caused by obesity, psychological stress, malnutrition, drugs and alcohol, chronic disease, autoimmune conditions, hypothyroidism, chronic pain, a history of steroid use, or head injuries like concussion. When we look at that list, outside of the concussion, the overriding obvious answer is that if you control your lifestyle, your body weight, and your food and alcohol intake, you'll actually remove nearly all the causes of secondary hypogonadism. Regardless of whether you've got primary or secondary hypogonadism, there's a reason why you might want testosterone therapy, because the symptoms can be quite debilitating. Symptoms like depression, which can actually lead to anxiety, low sexual function, low libido, erectile problems, even confusion are all symptoms of low testosterone. However, as I just said, you should be working to clear up all the lifestyle factors that might be influencing that suppression of luteinizing hormone before you worry about adding medication. In general, we're trying to take the least amount of medication as we get older, not the most. Don't use testosterone to mask your poor production when you can fix it simply by losing weight. Sadly, this is starting to affect people younger and younger, not just old guys. Young men who have not had optimal testosterone output during puberty have been shown to have a lot of problems even at an early age versus what was going on 20, 30, 40 years ago. These days, up to 20% of men under the age of 39 are considered to have low testosterone, which can lead to symptoms like depression and anxiety, which if you have a look around these days, seem to be far more common than they were only 20 or 30 years ago. This has been further compounded by the rise in obesity rates globally. From 1999 to 2016, obesity rates went up nearly 20%, from 55% to 65% in most Western countries. The result of these can lead to things like poor posture, metabolic syndrome, erectile dysfunction, low motivation, lower stress tolerance, fewer masculine or physical traits, and as you can see, all of these then add to a global problem of metabolic dysfunction and ongoing obesity. When you're trying to discover for yourself if you've got low T or if maybe it might benefit someone around you, there's a lot of things that people with low testosterone frequently say that might give a hint as to whether or not they could have their situation improved through medicinal addition of testosterone. Things like, I could go weeks without sex and not be phased. I can take or leave sex. I'm so tired after work, all I want to do is crash on the couch and have a nap. I always feel drained, even after I sleep for 8 hours. I don't even enjoy the things I used to like anymore. I'm easily overwhelmed by stress. I feel like it takes days to recover from exercise. I often wake up in the middle of the night and can't go back to sleep. And no matter how much I train and eat right, I can't build muscle. But most of all, I just feel like I've lost my mojo. Getting someone to assess you with low testosterone is probably getting a little bit easier than it used to be, but still very much has a stigma attached to it. In Australia, most GPs won't touch it. The rules have gotten a lot stricter, and finding a doctor who will do it correctly is getting much more difficult. The first thing that people will look at will be total testosterone. Total testosterone only tells part of the story because you have this other thing called free testosterone. Now, free testosterone is exactly what it says. It is a portion of your total testosterone that is floating around the body, unable to be used. And the reason it's unable to be used is because it binds to this thing called SHBG, or sex hormone binding globulin. And this is why you can go to the doctor, he tests you just for total testosterone, and you can still feel like crap because you've got nothing for the testosterone to bind to because SHBG is low. One thing to be careful of is that different labs assess different ranges as being normal. While researching this video, I found one lab in Melbourne that assesses the range of 5 to 25 as being normal, but another that said 12 to 50 was normal. The other thing to bear in mind is that over time, these results are actually becoming lower, and what is normal now actually would have been considered low only a decade or two ago. And so you can still have a normal range and actually still be in what would have been considered a low range 20 years ago, which is why you feel terrible. As an example, what's considered normal for testosterone now would have been considered low only 10 years ago. And this is why a good doctor will not just look at the numbers, but actually spend some time speaking to you. It's entirely possible you can have numbers in the normal range and still feel terrible, and they'll need to adjust your treatment accordingly to not just get the numbers right, but make sure you feel right as well. It's not just a numbers only approach. Now, I know I said that SHBG could be a problem, but low SHBG is a symptom, not a cause. Low SHBG can be caused by hypothyroidism, insulin resistance, or even liver failure. So that says again, if I want to improve my thyroid function, improve my insulin sensitivity, and make my liver healthier, I just need to look at the lifestyle factors like my diet and lose weight. It's going to be a much more effective path than going down this testosterone path that's not even going to influence what the symptom really is. Now, there are a lot of other hormones and markers that a doctor should test. I'm not going to go through all of them. I'm not a doctor. Their recommendations are the best things to listen to, but another big one that gets pushed when people start looking at TRT is this thing called DHEA. DHEA is important for a number of things like cognitive function, metabolism, and immune function. It also starts to decrease after the age of 35, so this is a natural place for doctors to start thinking if we supplement this, we might actually improve a bunch of other things. And when you look at the flowchart for how our hormones are worked, you see that DHEA is one of the very first precursors even before testosterone is made. The thinking is if I provide more DHEA into the system, then I'll make more testosterone as well. However, when you look at the chart, you also see that it can go down the estrogen side of things, and it's just as likely to create more estradiol and estrogen and create further problems for you. In fact, out of the people that I know who've been supplemented DHEA, it's about 50-50 for people who've had complications caused by the DHEA that went away immediately when they stopped taking it. A further sign for how problematic DHEA supplementation can be is that they give it to women who are going through both menopause and IVF in a hope to boost their overall hormone output. If you want to be a woman going through IVF or menopause and treat your hormone function the same way, then maybe DHEA supplementation's for you. Now, there's two main ways you can get testosterone. One's basically a cream or a gel that you rub on yourself, and one's an injection. Now, most mass-produced creams and gels are pretty worthless, as opposed to individually synthesized, compounded just for you cream that's made from a chemist who specializes in compounding things. There is a concern with people with creams that maybe their kids get into them or somehow they'll rub off onto their kid or their wife or anything. But given the best place to place it is on your scrotum, I can only say don't put your balls on your kid's face, and it'll probably be a great result for you. They're super convenient, they're very easy to use, they're temperature stable, and they're very, very convenient. The other option are injections. Injections are much more stable in terms of the amount of testosterone that will be in the body. It's a very, very convenient, cost-effective way to get your testosterone. However, you do have to put up with doing injections. As I said right at the start of the video, this is a ride that once you get on, you are never getting off. So if you're going down the path of testosterone injections, you need to be okay with injecting yourself 2 or 3 times a week to get really stable levels for the rest of your life. The final part of all this is that some doctors will prescribe these things called aromatase inhibitors. This is really kind of an old school thing that's a throwback to bodybuilding days where guys were producing huge amounts of testosterone and causing a huge rise in their estrogen levels at the same time. And these aromatase inhibitors are to decrease the effects of estrogen while they were super supplementing with crazy amounts of anabolic steroids. Most of these though are more likely recognized as having very bad side effects these days, and a good doctor, a modern doctor, will avoid them at all costs and try to keep you off them. What this usually means is that your TRT will be in a very responsible range rather than a super physiological range where you actually need extra help to look after the side effects of the amount of testosterone you're taking. Now, when it comes to TRT supplements, what you'll find is that guys over about 15% body fat will struggle with side effects more than guys with less than 15% body fat. They will continue to struggle with these side effects regardless of what medication they take until they fix their diet and lifestyle issues and lose all that body fat and get them back down under that 15% so they can remove all the unnecessary medications. Now, some final things to remember. This is not a steroid cycle. That's number one. This gets you back into the normal range if you had a problem with producing testosterone or your testosterone production was suppressed because of a number of lifestyle issues. Again, fix the lifestyle issues, you won't need testosterone supplementation at all. The second thing to consider is that this is a lifestyle commitment. Once you begin, if you stop, your symptoms will actually be worse than when you started in the first place. And that leads me to the third problem, which is that you need to consider fertility. Now, steroids don't make you infertile, but because they drop luteinizing hormone and this other thing, FSH or follicle stimulating hormone, down to 0 or near 0, those are the guys that put the lead in the sperm, if you get what I mean. So you can produce sperm but have no ability to make someone pregnant. When LH and FSH are low, you are effectively infertile. So if having kids in the future is something you're concerned about, you might need to take some steps before you start testosterone supplementation to make sure that you can make your wife pregnant if that's the route you want to go. And finally, for safety, constant consults with your doctor. That means every 6 months, get your blood work done, make sure everything's safe. Don't fly solo and think that you know more about the subject than your doctor does. This is a very tricky subject. Every single thing you put in your body is going to have a knock-on effect to another system in your body. And when you're playing with something as powerful as your hormone production, it has the ability to mess with a lot of other functions in your body, and constant consults are the only way around it.